Good day, dear students. I am Chmidronov Sergei Nikolaevich, the head of Human Anatomy Department in Samara State Medical University. And today we will start to study sensitive organs. And first we will talk about vision and smelling. In details we will talk about visual analysator and olfactory analysator. So, what can we talk about sensory organs? You must know that sensor systems, sensor organs, are receiving information from internal and external environment. You may see that analyzer is a set of central and peripheral formations that perceive and analyze changes in internal and external environments of body. And you may see common sensitivity from skin, from muscles, from tendons, and also you may see spatialist sensor system, vision, gustation, smelling, and also hearing. So first we'll talk about vision and smelling. You must know that Pavlov, the famous Russian scientist, said that each analyzer divides in three parts and consists from three parts: peripheral part first, conductor part second, and central or cortical part. And also we mind sensitive like conscious sensitive because the central part is localized in cortex of telencephalon. So, of all the human senses, the eye has always been recognized as the best gift and the most wonderful work of the creative power of nature. This famous phrase of famous scientists, German scientists, physiologist Helmholtz. And you know that there is the largest clinic, ophthalmic clinic, which is situated in Germany, named by Helmholtz. And first we will talk about visual analyzer and organ of vision. You know that light became the stimulus which gave rise in the animal world to a special organ of vision, eye. The main component of this organ in all animals are specific sensory cells which originate from ectoderm and are capable of receiving stimuli from rays of light. For the most part, these cells are surrounded by pigment which serves to channel the rays of light in definite direction and absorb superfluous rays. Such cells in lower animals are scattered over the body, primitive eyes, but eventually a depression forms light by sensitive cells, retina, which is reached by the nerve. In invertebrates, light refracting media appear in front of the depression lens for the concentration of light rays falling on the retina. Vertebrates whose eyes attain the highest development also develop muscles which move the eye and protective adaptation, eyelids, lacrimal apparatus. A characteristic feature of vertebrates is seen in the fact that the light sensitive membrane of the eye, retina, which contains specific cells, does not develop directly from the ectoderm, but first by projecting from the anterior brain vesicle. At the first stage of development of the visual analyzer in fish, the light-sensitive cells in its peripheral and retina look like rods, and only the visual centers are located in the brain, in the mesencephalon or midbrain. Such an organ of vision is only capable of light perception and distinguishing objects. The development of eyes in man is attained by high centers of vision in the cerebral cortex, which are responsible for the origin of abstract thinking closely associated with the visual images, and the written speech, which are a component of the second cyanalic system inherent only in man. So next, let's talk about development, embryogenesis of the eye. And you may see the pictures of embryogenesis. Let's talk in details. The lateral projection of the wall of the anterior brain vesicle, and you may see it here, number 2 or 3 on this picture under my pointer. The parts that give rise to the diencephalon here are stretching laterally from 2 optic vesicles communicating by a hollow narrowed stalk with the brain. The optic nerve develops from the stalk, and the retina forms from the peripheral segment of the optic vesicle. With the development of the lens, the anterior segment of the optic vesicle projects toward the stalk, and as a result, the vesicle becomes a double-layer optic cup. You may see also the first vesicle, and you may see transformation to double-layer cup. And here you may see 2. Both layers are continuous with each other at the margin of the cup to form the rudiment of the pupil. Here, a rudiment of pupil. The outer building layer of the cup develops into the pigmented layer of the retina, while the inner layer becomes the sensor layer, a retina proper. And you may see 2 these layers. This layer becomes in retina, but external layer becomes into pigment layer. The lens forms in the anterior part of the cup in its cavity, and the vitreous body falls behind the lens. And you may see future vitreous body behind lens, and also you may see vitreous body here, and also you may see the lens here. The external coats of the eye, the vascular coat, sclera and cornea, develop from mesoderm, surrounding the optic cup together with the lens. And also you may see mesenchyme is a part of mesoderm. The sclera and cornea are derived from the outer denser layer of the mesoderm, while the choroid with a ciliary body and iris develop from inner layer of the mesoderm, which is rich in vessels. At the anterior part of the embryonic eye, both layers separate one from the other, as a result of which the anterior chamber forms. In this place, the outer layer of the mesoderm becomes transparent and forms the cornea. And you may see this layer here, transparent layer, future cornea. The ectoderm covering the cornea in front provides the conjunctival epithelium, which extends to the posterior surface of the eyelid. And also we may see in number 10 eyelids and also posterior surface of eyelids. So you may see on this picture eyeballs of embryo in 6 weeks. Also you can see the eyeballs and rudiments of eyelids of 8 weeks embryo, and also you can see the eyelids of eye in fetus of 20 weeks here. Let's talk in details about eyeball. Eyeball, the eye, or oculus it's in Latin, consists of eyeball, bulbus oculi, and the auxiliary apparatus surrounding it. The eyeball is spherical in shape, is situated in the eye socket, orbita. The anterior pole corresponding to the most convex point of the cornea, and the posterior pole located lateral to the exit of the optic nerve are distinguished in the eyeball. The straight line connecting both poles is called the optic axis, or the external axis of the eye, axis opticus. The path lying between the posterior surface of the cornea and the retina is called the internal axis of eye. This axis intersects at a sharp angle with the so-called visual line, linea visus, which passes from the object of vision through the nodal point to the place of the best vision in the central pit of the retina. You may see this place here. The lines connecting both poles along the circumference of the eyeball from meridians, whereas the plane perpendicular to the optic axis is the equator of the eyeball, dividing it into anterior and posterior halves. The horizontal diameter of the equator is slightly shorter than the external optic axis. The latter is 24 mm and the former 23 mm. Its vertical diameter is even shorter, 23 mm. The internal optic axis of a normal eye is 21 mm. In myopic eyes it's longer, and long-sighted people, hypermetropic eyes, it's shorter. So to achieve clear vision, the hypermetropic people must always resort to accommodation to relieve such anomalies of sight. Adequate correction by means of eyeglasses is essential. The eyeball has three coats surrounding its inner nucleus: a fibrous outer coat, next vascular middle coat, and inner reticular coat. So the coats of the eyeball. And first we will talk about fibrous tunic or fibrous coat. Tunica fibrosa bulbi forms an external sheath around the eyeball and plays a protective role. At the posterior largest of its part, it forms an opaque tunic called the sclera, and the anterior segment a transparent cornea. So the cornea, you may see this transparent tissue here. Cornea is in continuation of the sclera and is transparent rounded plate, convex toward in the front and concave at the back. You may see it here too, which, like the glass in the watch, is fitted by its edge, limbus cornea, into the anterior segment of the sclera. And you may see that cornea has great refractive power, up 40 dioptries. And next, we talk about a second part of fibrous tunic. This is sclera. And sclera consists of dense connective tissue, white in color. Its anterior part is visible between the eyelids and is commonly referred to as a white of the eye. At the junction with the cornea and the thickness of the sclera, there is a circular venosus canal. You may see it here. This sinus venosus sclera, or Schlemmii canal, called Schlemm scanner. Since light must penetrate to the light-sensitive elements of the retina lying in the eyeball, the anterior segment of the fibrous tunic, I told you, becomes transparent and develops to cornea. Also, you may see sclera in histologic investigation. Next, let's talk about middle layer, middle tunic. This is vascular tunic, and it divides in three parts: choroid part or propryal tunic, and two derivatives, ciliary body and iris. And first, let's talk about choroid or propryal tunic or vasculus coat. So choroid is the posterior largest segment of vascular coat. Due to the constant movement of the choroid in accommodation, a slit like the lymphatic pericardial space is formed here between layers. So you may see the choroid tunic here in histologic investigation, and the anterior part of vascular tunic becomes a ciliary body. The ciliary body, corpus ciliare, you may see it under red arrow. The anterior thickened part of the vascular tunic is arranged in the shape of a circular swelling in the region where the sclera is continuous to cornea. You may see cornea here and a part of sclera. Its posterior edge, which forms the ciliary ring, orbiculus ciliaris, is continuous with the choroid, and you may see this continues here. This place corresponds to the retina or a serrata. In front, the ciliary body is connected with the external edge of the iris. Anteriorly of the ciliary ring, the ciliary body carries about 70 fine radially arranged whitish ciliary processes, and you may see these processes here. Due to the abundance of the particular structure of the vessels in ciliary processes, they secrete a fluid, the aqueous humor of the chambers. In Latin, this is humor aquosa. This part of the ciliary body is comparable with the choroid plexus of the brain, is known as Cicerent part. The other part, the accommodation part, is formed by the smooth ciliary muscle, musculus ciliaris, you may see it here, which lies in the thickness of the ciliary body externally of the ciliary processes. Formerly, this muscle was divided into three portions: external meridional, middle radial, and internal circulatory. Now only two types of fibers are distinguished, namely meridional, arranged longitudinally, and circular, arranged in rings. The meridional fibers, forming the principal part of the ciliary muscle, begin from the sclera and terminate posteriorly in the choroid. On contracting, they tighten the choroid and relax the sac of the lens, and adjusting the eyes for short distances. Accommodation. Circulatory fibers help accommodation, advancing the frontal part of the ciliary processes, and this is why they are particularly well developed in hypermetropics who must tense their accommodation apparatus very greatly. Thanks to elastic tendons, the muscle, after contraction, resumes its initial position, and there is no need for antagonist. Fibers of both kinds intertwine and form a single muscular elastic system, which in childhood consists mostly of meridional fibers and in old age of circulatory fibers. During the lifespan, the muscle fibers become gradually atrophied and replaced by connective tissue, which explains the weakening of accommodation in old age. In females, degeneration of the ciliary muscle begins 5 to 10 years earlier than in males, that is, with the onset of the menopause. Next, we talk about iris, and you may see the iris here. The iris is the most anterior portion of the vascular coat of the eye and is circular vertically standing plate with a round aperture called pupil. The pupil is not exactly in the middle, but is slightly displaced toward the nose. The iris plays the role of diaphragm, regulating the amount of light entering the eye. Due to this, when there is strong light, the pupil contracts, and when the light is weak, it dilates. With its outer edge, margus ciliaris, the iris is connected with the ciliary body and the sclera. Its inner edge surrounding the pupil, margo pupillaris, is free. The iris has an anterior surface, facies anterior, facing the cornea, and posterior surface, facies posterior. You may see two these fascias here, anterior and posterior. So, these fascias adhering to the lens. The anterior surface with the posterior surface, anterior surface and posterior surface you may see here. So, anterior surface, which is visible through the transparent cornea, is of different color in different people and determines the color of their eyes. This depends on the amount of pigment contained in the superficial layers of the iris, and you may see this pigment in black color here in the iris. So, in performing the function of diaphragm, the iris displays remarkable mobility. This is ensured by fine adaptation and correlation of its components. The basis of the iris consists of connective tissue with the architecture of a lattice in which vessels have been fitted radially from the periphery to the pupil. These vessels are the sole carriers of elastic elements and together with the connective tissue form the elastic skeleton of the iris, permitting it to change easily in size. The actual movements of the iris itself are accomplished by the muscle system lodged within the stroma. This system consists of smooth muscle fibers which are partly arranged in a ring around the pupil to form the sphincter of the pupil, and partly fan out radially from the pupillary aperture to form the dilatator of the pupil. Both muscles are interrelated, and after each other the sphincter stretches the dilator, while the dilator straightens outer the sphincter. Because of this, each muscle returns to its initial position, which explains the heredity of the movements of iris. This integral muscle system has a punctum fixum of the ciliary body. The sphincter of the pupil is innervated by parasympathetic fibers, but dilatator is innervated by sympathetic. So the vessels and nerve, in details, we'll talk about them in third term. Next, we talk about retina. Retina is the innermost of three coats of the eyeball, adhering to the vascular coat, along its entire length until it reaches the pupil. Unlike the other coats, it develops from the ectoderm, from the walls of the optic cup, and according to its origin consists of two layers, as I told you: the external pigmented layer, stratum pigmenti, and internal layer, which is the retina proper. The retina proper is divided in structure and function in two parts. The posterior, which contains light-sensitive elements, constitutes the optic part of retina, pars optica. And the anterior part, which does not have these elements. The junction between the two is an indented line, ora serrata. You may see it here. Indented line, it's in English, ora serrata is Latin, passing at the level where the choroid is continuous with the ciliary ring of the ciliary body. The optic part is almost fully transparent and epiphysis only in cadaver. On examination with the ophthalmoscope, the fundus of the eye in a living person is dark red because the blood in the vascular coat is seen through the transparent retina. On this crimson background, a white round spot is visible on fundus, which the site of the exit of the optic nerve from retina. So you may see on this picture light-sensitive visual cells. Their counts and rows. So the light-sensitive visual cells, I told you rows and counts. Since they are situated in the external layer of the retina and adhere to the pigmentary layer, to reach of them the rays of light must penetrate like this arrow, must penetrate the entire thickness of the retina. You may see on this picture rods and counts here. The rods contain visual purple, a rhodopsin, which is responsible for the pink hue of fresh retinal membrane in the dark. In the light is rendered colorless. The formation of visual purple is attributed to the cells of the pigmentary layer. The counts do not contain visual purple. It should be noted that there are only counts in the macula and no rods. In the region of optic disc there are no light-sensitive elements at all, as a result of which this place produced no visual sensation and therefore called the blind spot. So we talk about refracting media and eyeball curve. So transparent light refracting media of the eye are the cornea, the vitreous body, and the lens, which serve to form the image on the retina, and the aqueous humor, which fills the chambers of the eye and provides nutrition for the avascular structures of the eye. You may see a lens. A lens is very important like a refractive medium of the eyeball. It's completely transparent and shaped like a lentille or biconvex glass. The central points of the posterior and anterior convexities are called the pores of the lens, while the peripheral circumference of lens, where both surfaces join, is called equator. This axis of the lens joining both pores is 3 millimeter, 3.5 millimeter long, then looking at a distance, and 4.5 millimeters in accommodation when the lens becomes more convex. The equatorial diameter is 9 millimeter. The equator plane is at a right angle to the optical axis. The anterior surface of the lens is in contact with the iris. The posterior surface is in contact with the vitreous body. The lens is enclosed in thin, also absolutely transparent structureless capsule lentis, and is held in position by a special ligament called ciliary zonule or zonule of Sinn, which is made up a multitude of fine fibers running from the capsule of the lens to the ciliary body, where they are mainly distributed among the ciliary processes. So you may see these structures here, zonula ciliaris. So, due to the elasticity of the capsule, the lens easily changes its curvature depending whether the object we are looking at far or near. This phenomenon is called accommodation. In the first case, Sinn ligament pulls and the lens flattening it. In the second case, when the eye must be set at a short distance, the ciliary muscle contracts, relaxing Sinn ligament together with the capsule of the lens, bounding the lens more. As a result, the rays coming from nearby object are refracted more strongly by the lens and can merge on the retina. The lens, like the vitreous body, has no vessels. And you may see that the lens is one of the most powerful refractive structure. It has the power of since 9 to 33 dioptries. And you also may see on this picture disease of lens, cloud of lens, cataracta, and also you may see the surgery operation, a part of surgery operation, removing natural lens and implantation the artificial lens into eyeball. Next, let's talk about vitreous body, and you may see it here and here too. The vitreous body, or corpus vitreum, fills the space between the lens and the retina. You may see it here too. And it's an absolutely transparent mass resembling jelly. The lens presses into the anterior surface of the vitreous body, as a result of which a depression, the hyoid fossa hyoide, forms its edges are joined with the capsule of the lens by a special ligament. And you may see that vitreous body is also transparent, sphere, transparent media that has a refractive power up to 2 dioptries. Next, we talk about aqueous humor about liquid in eye. The space between anterior surface of the iris here and the posterior surface of cornea is called the anterior chamber of the eye, camera bulbi anterior. The anterior and posterior surfaces of chamber meet along the circumference in the angle formed by the junction of the cornea with the sclera. Ciliary margin of the iris, ciliary margin of iris. This is iridocorneal angle, angulus iridocornealis. You may see the angle between cornea and iris. It's rounded off by a network of trabeculae comprising in their entirety the pectinate ligament, ligamentum pectinatum anguli iridocornealis. And also you may see this angle here. The iridocorneal angle is of vital physiological significance from the viewpoint of the circulation of aqueous in the chamber, which drains through fontana spaces, you may see these fontana spaces, into Schlemm canal, located near by the within sclera. You may see the part of cornea, part of sclera. This is vein, which called Schlemm canal, and also you may see fontana spaces, and here you may see the transferring of humor aquosa into Schlemm canal to this place. So behind the iris is a narrower posterior chamber of eye, you may see it here, camera posterior bulbi, which included the spaces between the fibers of syn ligament, you may see this ligament here. It's bounded posteriorly by the lens and on the side by the ciliary body. You may see the posterior border of this camera. The posterior chamber communicates with the anterior chamber through the pupil. You may see part of pupil. Both chambers of the eye are filled with a transparent fluid, aqueous humor, and you may see the transport of humor aquosa. And you know that it drains into Schlemm canal. And let's read about aqueous humor, which form here in posterior chamber. You may read that aqueous humor contains nutrients, amino acids, glucose, nutrition for the vascular media like cornea, like lens, and also vitreal corpus, vitreal body. And you may see that these nutrients have nutrate lens, endothelium of cornea, trabecular meshwork, the anterior part of the vitreous body, avascular structures without blood vessels. Also, next function is a removal. This function to remove potential damage factors from the inside of eye. Also, you know that each fluid has a refracting function. Also, we may read this function here like refracting medium, and also This is very main function, intraocular pressure, and you may read that this pressure is near 16 to 26 millimeters of Hydroargyrum units. We talk in details about auxiliary devices of the eyeball. So you may read about these parts here. And first we talk about muscles. You may see motor apparatus here, and it consists of 6 striated voluntary muscles: superior, inferior, medial, lateral rectus muscles, and superior and inferior oblique muscles. All these muscles, with the exception of the inferior oblique muscle, arise in the depth of the orbit around the optic canal and adjoining part of the superior orbital fissure from the common tendinous ring, annulus tendinosus communis. And you may see this substance here. This ring, shaped as a funnel, invests the optic nerve with the ophthalmic artery as well as oculomotor, nasociliary and abducens nerve. The rectus muscles are attached by their anterior ends in front of the equator. You may see these places here. The superior oblique muscle passes through the fibrocartilaginous ring. You may see this ring here, and it causes trochlea, fastened to the trochlear fossa of frontal bone. And then it turns backward and laterally at an acute angle of this attached to the superior lateral surface of the eyeball behind the equator. The inferior oblique muscle arises from lateral circumference of the fossa of lateral or lacrimal sac and passes under the eyeball laterally and to the back below the anterior end of the inferior rectus muscle. Its tendon is attached to the sclera and the side of the eyeball behind equator. And you may see this attaching here, behind equator. The rectus muscles rotate the eyeball about 2 axes: the transverse axis, the superior and inferior muscle with the pupil directed upward or downward, and vertical axis, the lateral and medial rectus muscles with the pupil turning laterally or medially. The oblique muscles rotate the eyeball about the sagittal axis. In rotating the eyeball, the superior oblique muscle directs the pupil downward and laterally. Contraction of the inferior oblique muscle directs the pupil laterally and upward. It should be noted that all the movements of both eyeballs are coordinated, and any movement to any side of one eyeball is simultaneously paralleled by the other eye. When all the muscles are uniformly tensed, the pupil looks straight ahead, and the lines of vision of both eyes are parallel to each other. This occurs when a person looks far ahead. When objects are examined at a close distance, the lines of vision converge in front. Convergence of the eye. So, the tissue of the orbit is fascia and tendon capsule. You may see part of tendon capsule here. The orbit is lined with a perorbit, which fuses with the dura mater at the optic canal and the superior orbital fissure. Behind the eyeball is fatty tissue called the fatty body, of the orbit, corpus adiposum. You may see part of this tissue here. Fatty tissue investing the eyeball is separated from it by connective tissue layer, which surrounds the eyeball to form the facial sheath of eyeball, vagina bulbi. The tendons of the eyeball muscles running to the sides of their attachments in the sclera pass through the tendons capsule, which provides sheath for them. These sheaths are continuous with the fascia of the different muscles. Next, let's talk about eyelids and conjunctiva. The eyelids or palpebra are sliding shutters protecting the eyeball anteriorly. The upper eyelid, palpebra superior, is larger than the lower one. It's bounded above by the eyebrow supercilium, a strip of skin with short hairs laying on the boundary with the forehead. When the eye opens, the lower distance very slightly under its own weight, while the upper lid rises actively due to the contraction of the levator palpebrae superioris muscle connected with it. The free margin of both eyelids is narrow surface bounded by the anterior and posterior borders, limbus palpebralis anterior and posterior. Immediately behind the anterior border, several rows of short-haired hairs grow from the free margin of the eyelid. These are eyelashes or cilias here, which serve a lattice preventing small particles from hurting the eye. Between the free margin of eyelids is the palpebral fissure through which one can see the anterior surface of the eyeball when the eyelids are parted. In general, the fissure is almond-shaped, its lateral angle is sharp, the medial angle is rounded and forms what is known as the lacrimal lake. You may see the lacrimal lake here. Within the lacrimal lake, or lacus lacrimalis in Latin, a small pinkish eminence, the lacrimal caruncle, is visible, which consists of fatty tissue and tiny sebaceous glands with tender pili. The foundation of each eyelid consists of dense connective tissue plate termed the tarsus. In the medial angle of the palpebral fissure is a thickening. This is the medial palpebral ligament, which passes horizontally from both tarsi to the anterior and posterior lacrimal crests in front of and to the back of the lacrimal sac. Another thickening is located at the lateral angle of the palpebral fissure in the form of horizontal strip. This is lateral palpebral ligament, which corresponds to the lateral palpebral raphe stretching between the tarsi and the lateral wall of the orbit. Within the tarsi are the meibomian or tarsal glands, consisting longitudinal tubular passages with a lever on them which secrete a fatty matter, sebum palpebrale, it's Latin, for lubricating the margins of the eyelids. There are usually from 30 to 40 glands in superior tarsus and from 20 to 30 in inferior one. The meibomian glands have punctate openings of the free margin of two eyelids close to the posterior border. Beside the meibomian, there are ordinary sebaceous glands attending the eyelashes. As mentioned above, the upper eyelid has its own special muscle which raises it, the levator palpebrae superioris muscle. Posteriorly, you may see this muscle here, levator palpebrae superioris. Posteriorly, the tarsi are covered by the conjunctiva, which is continuous with the skin of their emergence. The conjunctiva of the eye covers the whole posterior surface of the eyelids, and near the edge of the orbit is reflected onto the eyeball and covers its anterior surface. That part covering the eyelids is called the palpebral part of the conjunctiva, while the part investing the eyeball is termed the ocular part, conjunctiva bulbi, it's in Latin. In this way, the conjunctiva forms a sac opened in front of the area of the palpebral fissure. The conjunctiva resembles a mucous membrane, although in origin it's continuation of the skin. On the eyelids, it's intimately fused with the tarsi, while for the rest of the length, it's joined loosely with the underlying parts until it reaches the edge of the cornea, where its epithelial layer is continuous with the corneal epithelium. The sites of junction between the palpebral and ocular parts of the conjunctiva are called the superior and inferior fornices of conjunctiva. So fornix conjunctiva superior and inferior in Latin. The superior fornix is deeper than the inferior one. The fornices are the reserve folds of the conjunctiva necessary to provide room for the movement of the eye and eyelids. The same role is played by the plica semilunaris conjunctiva, located in the middle angle of the palpebral fissure lateral to the lacrimal carbuncle. Morphologically, it's a rudiment of third eyelid, winking membrane. Next, we talk about lacrimal apparatus. You may see the lacrimal gland here. Lacrimal apparatus consists of the lacrimal gland, which excretes tears into the conjunctival sac, and on the lacrimal caneculae arising from this sac. The lacrimal gland consists of lobes and is alveolar-tubular in type. It lies in the lacrimal fossa of the frontal bone. From 5 to 12 ducts of the lacrimal gland open in the lateral part of superior fornix into the conjunctival sac. The ducts of the inferior part of the gland through its upper part. The lacrimal fluid moistens the surface of the eyeball, which is conductive to winking of the eyelid, and then drains into the medial angle of palpebral fissure to lacus lacrimalis. When the eyes are shut and fluid runs along the rivus lacrimalis, forming between the posterior borders of both eyelids and the eyeball. At the lacus lacrimalis, the tears flow into the punctate openings located at the medial end of the eyelids. Two fine lacrimal caniculi arising from these openings bypass the lacus lacrimalis and drain separately or by means of a common opening into lacrimal sac. And you may see this sac here. A lacrimal sac is the upper blind end of the nasolacrimal duct, which lies in a special bony depression at the middle angle of the orbit. The lacrimal sac from this side of the orbit is covered by a dense fibrous membrane attached to the posterior and anterior lacrimal crests and reinforced by the fibers of the medial palpebral ligament. The bundles of the lacrimal part of the orbicularis oculi muscle arising from the wall of the lacrimal sac may distend it and thus help to suck in tears through the lacrimal caneculae. The direct continuation of the lacrimal sac downward is the nasolacrimal duct. ductus nasolacrimalis in Latin, passing in the bony nasolacrimal canal under the inferior turbinated bone. You may see this bone here, concha nasalis inferior in Latin. So we see a little movie about eye.
Even at the limit of eye movement, we see less than half of its circumference.
Superior and inferior eyelids.
Here's
Also,
the eye,
may see
seen from
the
above.
eyeball, posterior
It occupies
sulcus,
only the anterior part of the orbit.
nerve.
The space behind it is largely occupied by fat that's been removed in this dissection. The tough outer coat of the eye is the sclera. The sclera extends from here behind, where the optic nerve passes through it, all the way round to here in front, where it becomes continuous with the transparent cornea. The cornea is the transparent window that allows light to enter the eye. The cornea is more sharply curved than the sclera. It bulges forwards. Behind the cornea, the colored iris forms an incomplete partition within the eye. At the center of the iris is a clear opening, the pupil. The size of the pupil is constantly changing to limit the amount of light that enters the eye. The iris is chiefly formed of muscle fibers. Fibers arranged radially cause the pupil to dilate. Fibers arranged circumferentially, both here and out here, make it constrict. The lens of the eye is just behind the iris and the pupil. Here, light from a slit lamp is coming in from the left side. Down here, where it's very bright, the light is hitting the iris. Here, where it's fainter, we're looking down into the orbit in a dissection in which the orbital roof has been removed. We'll start by looking at the rectus muscles. To see them, we'll take these two muscles, the levator and the superior oblique, out of the picture. We'll also remove some of the fat that largely fills the posterior part of the orbit. Here are three of the rectus muscles: superior, lateral, and medial. To see the inferior rectus, we'll remove the superior rectus, the optic nerve, and the rest of the orbital fat. Here's the inferior rectus muscle. Between the origins of the rectus muscles, the optic nerve emerges. The rectus muscles arise together from inside a ring of fibrous tissue, the annulus tendineus, of which this is the upper part. The annulus is attached to the periosteum of the apex of the orbit. Its ring of attachment, represented in blue here, encircles the optic canal and this part of the superior orbital fissure. The optic nerve, the ophthalmic artery, and several of the nerves to the orbit pass through the annulus. The rectus muscles thin out into four flat tendons as they pass forwards around the eye. They insert into the sclera quite far forward. To see where they insert, we'll go round to a view from in front. Here's the insertion of the superior rectus. Here's the lateral. Here's the inferior. Here's the medial. The main actions of the rectus muscles are obvious. The superior and inferior rectus muscles turn the eye upwards and downwards. The lateral and medial ones turn it outwards and inwards. Here's the superior oblique muscle. Like the rectus muscles, it arises from the annulus. The superior oblique narrows into a tendon which passes around this sling of fibrous tissue, the trochlea. The trochlea is attached to bone here, behind the orbital margin. The trochlea acts as a pulley. The superior oblique tendon fans out, passing deep to the superior rectus to insert into the sclera on top of the eyeball. We'll go round to our view of the eye from in front and add the oblique muscles to that picture. Here's the trochlea. Here's the superior oblique tendon. The superior oblique muscle, acting alone, would rotate the top of the eye medially. The inferior oblique muscle is down here. It's the only extraocular muscle that doesn't arise from the annulus. It arises here, behind the inferior orbital margin. It inserts into the sclera quite far back. To see that, we'll go round to our view from above and behind. Here's the inferior oblique, inserting into the sclera between the lateral rectus and inferior rectus muscles. The inferior oblique, acting alone, is just above the superior rectus muscle. Here it is. Arising from the annulus fibrosus back here, the levator fans out to become a broad tendon which inserts, as we'll see later, mainly into the tarsus of the upper lid. Incorporated in the underside of the levator is a strip of smooth muscle, the superior tarsal muscle, that's innervated by sympathetic fibers. Changes in the tone of this smooth muscle cause our upper lids to droop when we're tired and open wide when we're excited. The eyelids are covered on the outside with skin that's extremely thin and mobile. They're covered on the inside by a thin sensitive membrane, the conjunctiva. This is the conjunctiva. Conjunctiva also covers the front of the sclera. The conjunctiva that covers the sclera, the bulbar part, and the conjunctiva that lines the lid, the palpebral part, are continuous at this fold, the conjunctival fornix. The conjunctiva is continuous with the skin at the margin of the eyelid. Directly beneath the skin of the eyelids, which we'll remove, is the orbicularis oculi muscle. As we saw in part 1 of this tape, the orbicularis extends beyond the margins of the orbit onto the forehead and the cheek. It's such a thin muscle, parts of it are almost colorless. Medially, many of its fibers arise from this structure, the medial palpebral ligament, which is attached to bone here at the anterior lacrimal crest. The more outlying fibers of orbicularis arise from bone here, around the lacrimal groove. Laterally, the innermost fibers of orbicularis insert into bone here. The more outlying fibers have no bony attachment. This is part of the orbicularis. It's been divided along this line. Directly beneath it is this layer of fatty fibrous tissue, the orbital septum, that extends into the lid from the periosteum at the orbital margin. The orbital septum separates the contents of the orbit from the facial soft tissues. Here beneath the orbicularis is the structure that gives the eyelid its shape, the tarsus. It extends from here to the lid margin. To see the tarsus from in front, we'll remove the orbicularis muscle and then the orbital septum. We have also removed much of the orbital fat. The tarsus is here. If we put something underneath it, we can see its upper border. The tarsus is tethered at each end to the palpebral ligaments. The tarsus is quite flexible. It stiffens the eyelid and gives it a curvature that varies so that the shape of the eyelid conforms to the changing curvature of the underlying eye. Within the thickness of the tarsus are numerous tarsal glands. This is one of them. The tarsal glands open here, right along the margin of the lid. The tarsal glands produce an oily secretion which prevents the spillage of tears. This structure, coming down from behind, is the levator muscle. This is its tendon. The levator tendon inserts mainly into the tarsus. Its most lateral and medial fibers are attached to the palpebral ligaments. Here's the orbital margin. Here, just below and behind it, is the lacrimal gland, which secretes tears. It lies in this hollow in the roof of the orbit, the lacrimal fossa. The many small ducts of the lacrimal gland open into the conjunctival fornix up here. Tears leave the space in front of the eye through two small openings called puncta. Here's the lower punctum. To see the upper one, we'll roll the upper lid outwards. Here's the upper punctum. To see where the puncta lead, we'll look at a dissection in which the orbicularis has been removed and blue material has been injected into the puncta. Here's the upper punctum. Here's the lower one. Leading from them are the canaliculi. Here's the upper canaliculus. Here's the lower one. The two canaliculi converge behind the medial palpebral ligament, which we'll remove. The canaliculi join together and enter this reservoir, the lacrimal sac. The lacrimal sac is surrounded by the fibers of origin of the orbicularis muscle. When we blink, the pressure from these muscle fibers squeezes tears from the lacrimal sac down into.
So you have seen the eyeballs and auxiliary elements. Next, let's talk about some abnormalities of organ of vision. Let's read these main abnormalities. First, you can read congenital myopia with excessive growth of the eyeball inland. Light rays intersect without reaching the retina and again diverge. Images are fuzzy. Congenital hypermopia or hypermetropia. The eyeballs is shortened. Light rays intersect behind the retina. Next, you may read astigmatism, a regular curvature of the cornea or lens. Next, coloboma, cracks in the iris or fissures, pathologic fissures in the iris and ciliary body. Congenital cataract, clouding of the lens. Congenital glaucoma, underdevelopment of the venous sinus and pathologic pressure, increased pressure in eyeballs. Anophthalmia, the absence of eyeball. Aphakia, the absence of the lens. And one eye presence only, this is cyclopia. So you can see cyclopia here, anophthalmia here, the absence of eyeball, glaucoma, the increase of intraoptical pressure, and also you can see the fissure in iris coloboma. And at last, let's talk about visual analyzer, about anatomic pathways. So light stimulates the light sensitive elements located in the retina. Before falling on the retina, the rays of light pass through different transport media of eyeball from this side in arrows. First through the cornea, then through the aqueous humor of the anterior chamber, and then through pupil, regulates the amount of light rays passing into the depth. And the dark the pupil dilates to let through more rays, and in light it contracts on the contrary. This regulation is accomplished by special smooth muscles, sphincter and dilatator of pupil. The rays of light pass farther through the light refractive medium of the eye, lens, which helps the eye to see objects near and far, irrespective of the distance of the object. Its image is always imprinted on the retina. This accommodation is ensured by the presence of special smooth muscle, the ciliary muscle, which changes the curvature of the lens and is innervated by parasympathetic nerves. So, next, the light rays go through a vitreal body to retina, and you may see retina on this picture. Rays of light go through layers of retina to receptors, rods and cones. So, the nerve elements of retina form a chain of 3 neurons. The first link of this chain consists of the light-sensitive cells. Rods and cones, as I told you, which constitute the receptor of visual analyzer. The second link is made up of the bipolar cells. You may see these cells here. And the third of multipolar cells, ganglion nervi optici, whose processes continue into the nerve fibers of the optic nerve. You may see in yellow color here. As an extension of the brain, the nerve is covered by 3 meninges, forming a sheath for it which fuses intimately with the sclera of the eyeball. Spaces called intervaginal are preserved between the sheath, spatial intervaginalia, corresponding to the space of the brain, are formed between the meninges. On passing out of the orbit through optical canal, the optic nerve approaches the inferior surface of the brain, where it partly decussates in the region of optic chiasma. Only the medial parts of these nerves, around from the medial halves of the retina, decussate. The lateral parts, running from the lateral halves of the retina, remain uncrossed. This is why every optic tract, you may see these tracts here, arising from the chiasma, contains fibers in its lateral part, running from the lateral half of the retina of the eye located in outside, and the fibers in the medial part running from the medial half of the contralateral eye. Knowing the character of chiasma, the site of the lesion of the visual tract can be determined by the character of the loss of vision. Thus, for example, when the left optic nerve is affected, the left eye will become blind. In a lesion of the left optic tract or optic center of each hemisphere, vision is lost on the left halves of the retina of both eyes, half blinds of both eyes, hemianopsia. So, both the crossed and uncrossed fibers of the visual tracts and in 2 bundles of the subcortical visual centers, the superior quadrigeminal bodies and the thalamus pulvinar and lateral geniculate body. And you may see these elements here, pulvinar thalami and lateral geniculate body. So, in these elements are located fourth neurons of visual analyzer. The axons of the latter pass through the dorsal part of the posterior genu of internal capsule and then form the optic radiation, radiatio optica, in the white matter of the cerebral hemispheres, which reaches the cortex of the occipital lobe of the brain. These described conducting pathways from the receptors of light to the cortex, beginning with the bipolar cells, second link of the nerve elements of the retina, constitute the conductor of visual analyzer. Its cortical end in the cerebral cortex lying along the banks of the calcarine sulcus. Area 17. The light stimuli falling on the receptor located in the retina and converted into nerve impulses which pass the land of the conductor to the cortical end of visual analyzer. So next, let's talk about olfactory system, organ of smell. So in all animals, both in vertebrates and even in invertebrates, the essential part of the organ of smell consists of the primary type of sensory olfactory cells lining the olfactory fossa, which is actually a protrusion of the ectoderm. In higher vertebrates, the nasal cavity olfactory fossa is widened and deepened. It's surrounded by the cartilaginous nasal capsule of the cranium with the formation of nasal concha on its inner surface, which increase the receptive surface of olfactory area. In macrosmatic animals, this feature attains its greatest degree and they possess an abnormally acute sense of smell. Predators, rodents, hoofed animals, and some other species. Microsmatic animals, including monkeys, some cetaceans, and humans, begins to are in contrast endowed with a more or less reduced olfactory apparatus. In view of these, their rhinencephalon is developed far less than the powerful rhinencephalon of macrosmatic animals. Finally, in anosmatic animals, dolphins, the olfactory apparatus disappears completely already in embryonic life. The developed nasal cavity, as we see it in the normal adult, enlarges the olfactory organ and serves at the same time as the upper respiratory tract. On entering the nasal cavity with the air during respiration, fragrance substances stimulate the specific sensory elements of the organ of smell. These sensory elements, the olfactory cells, constitute the receptor of the olfactory analyzer, which is situated in the olfactory region. And you may see these elements here, and you may see olfactoric region. Regio olfactoric is in Latin. There's nasal mucosa in superior nasal concha and contralateral area of nasal septum. Also, we have additional olfactory system opposite inferior nasal concha or Jacobson organ. So you may see this place on septal part of nasal cavity, and also you can see on this picture the mucous tissue of inferior nasal concha, and also you can see in details the place of additional olfactory system. So let's we talk in details about olfactory analysator. You may see peripheral part, olfactoric cells here. There are first neurons of the olfactory analysator, and their axons, and number 3, as a component of villi olfactoria, passes through the openings of the cribriform plate of the ethmoid bone into the olfactory bulb, where they terminate to the olfactory glomeruli. And you may see these connections here. You may see the axons of olfactoric cells, the foraminas of cribriform plate of ethmoid bone, and olfactory bulb with the mitral cells here. So the second neurons, as I told you, are mitral cells. Their axons pass as a part of the olfactory tract and terminate in the cell of gray matter of this tract, the olfactory trigonum. The anterior perforate substance and septum pellucidum. The greater part of these fibers, pass to the cortex of parahippocampal gyrus. You may see this part here, and uncus, where the cortical end of the olfactory analyzer is located. So you may see these centers here. And I want to tell that olfactory impulses are correlated with somatosensory centers, also with hypothalamic structures like tuberous cinereum and mammillary bodies. And you may see these elements here, mammillary bodies. Here the olfactory impulses come in contact with the sensory systems of viscera, including the gustatory system. This efferent tract is a component of the fornix creusis partly in the hypothalamic commissure and terminates at the anterior column of the fornix in the mammillary bodies. So you may see mammillary bodies and fornix here. So we listened to the lecture about vision and smelling organs. Thank you very much for your attention. See you again on the next lecture. Bye bye.